Hey everyone and welcome back to our channel. Today, we're diving deep into a topic that's crucial for so many people, insulin. Whether you're a healthcare student, a patient, or just curious. Understanding insulin is key to managing diabetes effectively. Let's break it down. So, what exactly is insulin? It's a peptide hormone that plays a starring role in controlling our blood glucose levels. Think of it as the key that unlocks our cells, allowing glucose to enter and be used for energy. This lowers the amount of sugar in our bloodstream. It is essential for managing type 1 diabetes and is also used in advanced stages of type 2 diabetes. There are many different types of insulin, and they're mainly classified by how quickly they start working and how long they last. Let's start with the speedsters, the rapid-acting insulins. Examples of rapid-acting insulin include Lispro, Aspart, and Glulisine. These guys get to work incredibly fast, with an onset of just 10 to 15 minutes. They hit their peak effect in about 1 to 2 hours and are out of your system in 3 to 5 hours. Because they're so quick, they are typically taken just before or even immediately after a meal. Their job is to mimic the natural insulin spike our body produces after eating, which is why they're often called mealtime or bolus insulin. This rapid action also means there's a lower risk of delayed hypoglycemia, or low blood sugar. Happening hours later, you'll often find these insulins used in insulin pumps for a continuous, controlled delivery. Next up, we have short-acting insulin. The classic example here is regular insulin. It's a bit slower than the rapid-acting types, with an onset time of 30 to 60 minutes. It peaks between 2 and 4 hours and lasts for about 6 to 8 hours, because it takes a little longer. To kick in, it should be given about 30 minutes before a meal. A super important exam tip and clinical fact is that regular insulin is the *only* type of insulin that can be administered intravenously, or for. This makes it a critical tool for treating serious conditions like diabetic ketoacidosis, or DKA, and for managing blood sugar levels during and after surgery. Now let's move on to the intermediate-acting insulins. The main player in this category is NPH, which stands for neutral protamine hagedorn. NPH starts working in about 1 to 2 hours and has a broad peak, hitting its maximum effect anywhere from 4 to 12 hours. Its duration is around 12 to 18 hours. One unique thing about NPH is its appearance. It's a cloudy suspension, and like most other insulins which are clear, you need to gently roll the vial or pen between your hands to mix it before use. Because it has a distinct peak, there is a higher risk of hypoglycemia, especially nocturnal or nighttime low blood sugar, if the peak action occurs while you're sleeping. NPH is typically used as a basal insulin, meaning it provides a background level of insulin, and it's usually dosed twice a day. It can also be mixed in the same syringe with short-acting insulins. Following that, we have the long-acting insulins. This group includes Glargine and Detamir. They have an onset of about 1 to 2 hours, but their claim to fame is that they have no significant peak. They provide a steady, consistent release of insulin that lasts for approximately 24 hours. This peakless profile is a huge advantage because it significantly lowers the risk of hypoglycemia compared to NPH. They act as a true basal insulin, providing a stable foundation of insulin coverage throughout the day and night. Because of this, they are usually taken just once a day. A key rule to remember is that you should never mix long-acting insulins like Glargine or Detamir with any other insulin in the same syringe, for even longer coverage. We have the ultra-long-acting insulins. The prime example here is insulin degludec. This one starts working in about an hour and has an incredibly long duration of over 42 hours. Like the long-acting insulins, it has no peak, which translates to very stable and predictable blood glucose control. This extended duration offers more flexibility in dosing time, which can be a game-changer for people who have struggled with recurrent hypoglycemia or have unpredictable schedules. It provides a very smooth and steady basal insulin level. Finally, let's talk about premixed insulins. As the name suggests, these products contain a fixed combination of a basal and a bolus insulin. Common examples include a 70-30 mix, which is 70% NPH and 30% regular insulin, or a 75-25 mix, which is 75% of an NPH-like component and 25% of a rapid-acting insulin like Lispro. The main advantage of premixed insulin is convenience. It reduces the number of daily injections, which can be a huge help for patients who have difficulty managing a more complex regimen with multiple shots. The trade-off, however, is less flexibility. Since the ratio is fixed, you can't adjust the mealtime and basal doses independently, which can make it harder to fine-tune blood sugar control. Of course, like any medication, insulin has potential adverse effects. The most common and most serious one is hypoglycemia, or low blood sugar. It's crucial for anyone using insulin to know the signs of hypoglycemia like shakiness, sweating, and confusion, and how to treat it quickly with a source of fast-acting sugar. Other side effects can include weight gain and lipodystrophy, which is a change in the fatty tissue at injection sites. This is why it's so important to rotate where you give your injections. Allergic reactions are possible but are quite rare with modern insulins. So let's quickly recap the high-yield exam tips. Remember regular insulin for use, especially in DKA. Think of NPH as the cloudy one with a peak that can cause hypoglycemia. Glargine and Detamir are your long-acting, peakless basal insulins, and Lispro and Aspart are your super-fast mealtime insulins. Understanding these different types of insulin is fundamental to creating a personalized and effective diabetes management plan. It's all about matching the right insulin action profile to the individual's needs, meals, and lifestyle. If you found this video helpful, please give it a thumbs up, and don't forget to subscribe and hit that notification bell so you don't miss our next video. If you have any questions, drop them in the comments below. Thanks for watching, and see you in the next one.